Hey, Lori here, pharmacist. So, there's so much on the topic of vaccines, and me trying to email back and forth is extremely laborious. So, I just thought as a follow up to some of the conversation we've been having, I would make a few videos and try to touch on a couple of different topics, and also that way, I mean, truthfully, this video could go 5 hours, okay, if I was to sit here and try to tell you everything I've learned, especially over the last year. But I'm going to try to condense it down to one topic, which is going to be the HPV, because we've been going back and forth about that. And that way, maybe it can just help you grasp what I'm saying, because I had to learn in bites. I mean, it's big. So anyway, but I'm going to start by giving you a little background about me and how I got to where I'm at. When I was in pharmacy school, I can remember sitting in class, learning about the body and the different functions, the brain, the kidney, the liver, the heart, all that good stuff. Then they bring in the drugs and how they work in the body and pull all that together. And I will honestly tell you that in pharmacy school, I really questioned if I had picked the right profession for myself. I come from a line of pharmacists. My father was a pharmacist. My grandfather, Wise's drugstore in Gainesville, that's my family. So pharmacy's in my blood, I guess, if you will. But I had already pursued nutrition to a large degree, just as far as for myself. My mother was very health conscious. She taught me to be. My mother was also a person that questioned everything, and she taught me to do that too. And I'm very thankful for that. So suffice it to say, I've paddled upstream a lot of my life, okay? I tend to go against the flow. I question things. So, but I was already too far in, to pharmacy, had student loans, and so I, went ahead and graduated, and also came to the realization that most people, I know you know this, would rather pop a pill, eat whatever they want, live their life however they want, not take the narrow road, and pop the pill, shoot up the insulin, whatever it takes. They're not interested in changing their diet. And so as a retail pharmacist, I talked to a lot of people over the years about nutrition and how they could reverse their disease, and gave them literature, but the majority of the people weren't interested. And that's okay. We all have a right to choose how we want to live our lives. So I did retail pharmacy. Now, the interesting thing is I have 2 children that are now in their 20s. They were born in 96 and 98. Crazily enough, and I look back and I believe now it was really the grace of God, they were hardly vaccinated at all. And the reason was, I'd come through pharmacy school, learned how drugs worked in the body, knew that at least for myself, I was never interested in being on prescription drugs. Not unless it was no other way out. I'd rather eat carrots and cucumbers all day long than pop diabetic pills or high blood pressure pills or anything like that. It just is not. And another thing that I saw in pharmacy school that concerned me is, we look at these drugs and they do this in the body and that in the body, but how are these things going to be long term? How good can this be to alter body functions long term? That's another video. And as it turns out, we can see on a lot of levels, like the PPIs and the serotonin reuptake inhibitors and different things, that we're finding that those drugs long term aren't great by a long shot. So, but I didn't vax my kids because while I was actually pregnant with my daughter, my mother had handed off to me some cassette tapes from a naturopathic doctor in Tulsa, Oklahoma. And he just talked about reversing disease naturally. He talked about letting the body fight off the infection with fever. He just really explained diseases in a way that I had not heard in pharmacy school, and to me, quite frankly, made a whole lot more sense. He also talked about vaccines. He talked about the statistics. I looked at how the diseases were eradicated on the way on the decline before the vaccines ever came out on the market. So, and I knew autism was on the rise. And I just made the decision, I don't think vaccines are for us. Now, the interesting thing is, I homeschooled my kids. I worked part-time. I was a single mom. My kids were hardly ever sick. My daughter was literally on an antibiotic when she was an infant for, I think I gave her 2 doses. I thought she had an ear infection, new mama freaking out and all that. Turned out, I don't think she did. I think she was just teething or something, but that was it. My son has never been on an antibiotic. We never went to the doctor. I mean, hardly. If they got sick, it was usually a flu bug that lasted in our house. It was the 18 to 24 hour flu. I'm not lying. I let the fever run. I mean, there's, more discussion about that, but that's just kind of how I approached it. And none of my kids had autoimmune disorders. They weren't ADD or ADHD. They were never really diagnosed with anything. I mean, we never even went to the ER. It was incredible. We had dirt bikes and horses and the whole 9 yards. So, but while I'm raising 2 healthy children that are part-time in child care with a private care provider who kept other kids, the kids in that bunch were very sick. The kids I'm filling prescriptions for are extremely sick. I'm filling, asthma meds, nebulizer meds, antibiotics. And honestly, I thought it was due to the way they fed their kids. Because my kids had a very healthy diet. We were vegetarian. They weren't raised on fluoride. They weren't raised on a lot of things. And so I thought it was all related to diet. And I was so out of the loop when it came to vaccines because of that. So my kids are like, I'm going home to well kids, filling prescriptions for very sick kids, thinking if these parents would just change what they ate and I could look in the buggy and see what they were feeding their kids, these kids would be okay. Which brings me to another topic as far as kids is how sick our children are in this generation. This generation, I mean, it's not just autism. It's asthma. It's all kind of autoimmune disorders. I listened to something the other day. 54% of our children have an autoimmune disorder or some kind of illness. 1 in 6, and this is per the CDC, has a learning disability. It's estimated 1 in 30-something, 36 to 40 is autistic. So we are dealing with an incredible generation of sick kids. We are also dealing with an incredible generation of vaccinated children. However, like I said, I was out of the loop on vaccines, so I didn't even tie that into the equation as to why my kids might be well and maybe somebody else's might be really sick. Never went there. Well, last year, I'm reading stories about children's deaths in the media, mainstream media, about, involving the flu shot. And I just really saw where they were lying to us. Because I started reading between the lines and doing more investigating in some of these stories. And anyway, I stood up and I made a video, and it had to do with childhood deaths, the flu shot, and Tamiflu, you need to know the truth or something. It's on my YouTube channel. Now, when I posted that video, first video I've ever made, I just stood up and went off for 14 minutes, literally. And on Facebook, I was a nobody. I didn't know anybody. I had a few friends, but I was not much of a Facebooker. Anyway, in less than a week, it got like 1.2 million views. So that launched me into something. And then I had people start asking me, because I stated in the thing, and thank God they weren't vaccinated, really meaning the flu shot in the video, but in general, because my kids never got the flu shot, of course. Anyway, it just took off. People just pouring in, asking me questions, I guess, especially because of me being a medical professional. And it's so rare to see, as you know, a pharmacist that is taking a stance against vaccines or anything with the pharmaceutical industry. Most of us are just in the amen corner. Well, that's what launched me into this. So I'm going to pick up with HPV. Sorry, we're 10 minutes in, but I wanted you to have a little history of where I come from on this and what drives me, because that's one of the things you've kind of asked me, and I'll tell you what drives me. Children drive me. It breaks my heart. And if you start reading things that really involve the kids that are being injured, maimed, permanently, and killed by these vaccines, the things that never make mainstream media, and it's out there, and I can hook you up. It's going to take a little bit of time for you to watch it, but there are vast injuries out there, and we have no tracking system that tracks this stuff. We have VAERS, but that's considered to only capture like 1% of the true vaccine injuries. That's another video for another day. But anyway, my passion for people, my passion for justice, and my passion for children is what drives me. So, that being said, let's pick up with HPV. So I'm going to read this statistic. This was reading from 2003 to 2007. This is cervical cancer, National Institute of Health fact sheets. I thought it was interesting because it's pre-HPV vaccine. According to the most recent period of recent data for the period 2003 to 2007, the incidence of cervical cancer was 8.1 cases per 100,000 women per year in the United States. Mortality rate was 2.4 deaths per 100,000 per year. Okay, so why is that important? Because if you translate that number, 8.1 into 100,000, you're going to come out with approximately 1 in 12,346 women were contracting cervical cancer before the HPV vaccine was introduced on the market in 2006. So why is that important? Well, because that means cervical cancer just overall, and if you do your research, you'll find out that it's pap smears that really incredibly have reduced cervical cancer. And as you know, with the HPV vaccine, they're still saying get your screening. So, but yearly screening for women, if you go back and look from the 1970s till now, that's what really drastically dropped cervical cancer. So here we are, we're at this number, 1 in 12,346. So what happens now, we come out with an HPV vaccine, and by the way, that vaccine runs $300 to $500 for the series of doses. So we're going to vaccinate all these people to save this one poor soul that got cervical cancer. Well, that would be fine if nothing out of the clinical trials had shown that there was any danger to this vaccine, remembering that the clinical trials are done by the pharmaceutical industry. That whoever's going to make money on the vaccine is the guy who's funding the clinical trials, correct? What could possibly go wrong? Well, but anyway, if you read the clinical trials, though, really a lot of things went wrong. So what happened? Well, let's go over that. So let me explain. When they do a clinical trial, the way they did the Gardasil, and I'm going back to the original Gardasil because it was the only one that was tested against a placebo. The Gardasil 9, which is what they're given now, the placebo was Gardasil. So in the regular Gardasil clinical trial, you had an aluminum adjuvant. They label it AHS, and then you had a saline placebo. Now, interestingly enough, this aluminum adjuvant represented, in one of the trials, it was like 3,000 recipients. I can't remember if it was male or female, but anyway, I think it was in both. There was 3,000 in both, of the male and the female, 9 to 26-year-old girls that were studied. And then only about 10%, which was 300, 10% got the saline placebo. So, but then when you keep reading, when they looked at the total adverse events, etc., incidences, they combine these two groups. So we know if we inject saline, what's going to happen? Like nothing. And in fact, the saline that they use in clinical trials, they actually doctor it with something, some kind of L-histidine sometimes. I don't know exactly what they put in it, but they do that. It has to do with, or so they say, so the person thinks they received a vaccine. So anyway, but they combine these two groups together to give you their statistics. So when you look at autoimmune reactions that occurred in the clinical trials after the vaccine, they have a list of that, and they give the percentage. Well, along about the same percentage came out of this placebo group. This was the total placebo, if you can see that group, as did the Gardasil. The percentages were very, very, very close. So anyway, what came out of that trial? Well, you know, every time I read this vaccine, these clinical trials, I got to tell you, my mind is absolutely blown. So one of the things that happened, this is out of the Gardasil 9, because the Gardasil straight did not give these statistics. Serious adverse events in clinical studies. Serious adverse events were collected through the entire study, ranging 1 month to 48 months past last dose. For the 7 clinical studies of GARD-9 out of 15,000 participants, blah, 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 354 reported a serious adverse event. Now, a serious adverse event is considered life-threatening, went to the hospital, almost died. That's what's classified as a serious adverse event, which was 2.3% of the population. And then 185, let's see, then as a comparison, who were administered Gardasil, in the Gardasil group, actually 2.5% of people presented with a serious adverse event. Okay, so it's 2.5% that received the Gardasil. I hope I'm not. I know I'm kind of combining two package inserts, but what came out of the Gardasil group is really interesting, especially in regard to pregnancy. So we got 2.5% in the GARD group and 2.3% in the GARD-9. Okay, well, I think my thing is losing its... So, well, you say, well, what difference does that make? Well, I'll tell you what difference this makes. If I had a 1 in 12,000, chance here of getting cervical cancer, and interestingly enough, if you look at, because I know that cervical cancer is not the only thing that the HPV vaccine prevents, quote unquote, oropharyngeal, anal cancer, vaginal, vulvar. Well, the incidence of all those cancers is about as low or lower than cervical. All right. So except for oropharyngeal, we're at about 11 in 100,000 in 2016. So it's a little higher. But my point I'm making is, these types of cancers are not rampant types of cancer. And we also know, if you do a little research on HPV, that it is eradicated by immune system. The stronger your immune system is, the more likely you are to eradicate whatever strain you acquire. We also know there's over hundreds of strains. We know that just about anyone who's sexually active is going to acquire one or another strain of HPV. The question is, do you get one that's cancer causing? So, hence the vaccine. So anyway, that even further reduces people, But back to this. So I'm going to inject over 12,000 women, and yet, or whatever the percentage of that's getting the male type of cancer, and yet this many people out of that group, a much larger percentage than the incident to begin with, is statistically going to come back with a serious adverse event. And death was one of the outcomes in these trials, both of these trials. So that, but you know, okay, serious adverse event. Okay, you just went to the hospital, spent a ton of money, right? That's these people with a serious adverse event. You can go on to read, and it talks about systemic autoimmune disorders. Mind-blowingly, people that have been injected presented with autoimmune disorders after injection, to the tune of 2.2% in the Gardasil 9 group and 3.3% in the Gardasil group. Serious autoimmune disorders. What do we know about vaccines? Well, we know that they screw with your immune system, for lack of a better term. They jack with your immune system. That's a whole nother chapter for a whole nother day. But serious autoimmune disorders tend to hang around with you, okay? They tend to kind of be a lifelong deal that you're somehow treating pharmaceutically. So, you know, this is just me, but if I really knew these facts, and I do, and so does my daughter, would I rather take my chance of being a 1 in 12,000 plus and go get my pap smears, or do I want to get jacked up with this vaccine and potentially have a 2.5 or 2.3% chance of a serious adverse event occurring? How much is that hospital bill going to run me? Or presenting with an autoimmune disorder down the road. And the other thing is, there's so many kids that have died from this vaccine, or their lives have been altered permanently. And it will break your heart when you see. You know, there was a kid last year in Iowa, 14-year-old boy, got the HPV vaccine. It took a couple of weeks before, or it might have been a month later, and I can hook you up to that story. But his neurologist, he died of the disseminated encephalitis, which that's a whole other thing. He's pulling this post-marketing stuff, and I love their disclaimers. You know, it just blows my mind. It says, because these events were reported voluntarily from a population of uncertain size, it is not possible to reliably estimate their frequency or to establish a causal relationship to vaccine exposure. Really? Is that the best we can do? Because when you look at what presented after the post-marketing, people that received the vaccine, don't you think maybe a little better tracking system could be put into place? It seems to me. But then do we want to know the truth? Hence Vioxx. You think that Merck didn't know Vioxx was killing people in the clinical trials? No, it wasn't until enough people died that the vaccine, that the pill got pulled. All right. Blood and lymphatic system disorders, autoimmune hemolytic anemia, idiopathic thrombocytopenic purpura, gastrointestinal issues, death, vomiting, what was the autoimmune diseases, hypersensitivity reactions, nervous system disorders, acute disseminated encephalomyelitis, Guillain-Barré, motor neuron issues. Seizures. It's like when you read this, you go, I think I'll take my chances with cervical cancer there. I really do. Thanks, but I'll pass on that vaccine. That's just me. That's my conclusion. And I honestly, if for people that really read this stuff and know the facts, so I got your Cochrane, and I don't know if they're a nonprofit. I'm not sure where they get their funding. I have not done that research. Maybe you know, but you're telling me, yeah, it reduced the incidence of precancerous lesions, and okay, that's great. But what about all these people? What about all these people that got the vaccine and didn't fare well and ended up with way more problems than they had for potentially something that was such a low incidence of getting anyway? That's where I'm coming. And how many gazillions for the pharmaceutical industry based on vaccinating all these people that are running going, oh my God, we get cervical cancer, and they never stop and do their research. They just blindly follow. I mean, you draw your own conclusion. I don't know, but that's the conclusion I've come to. And the sad thing is, when you really look at most of all the vaccines, and I am going to touch on Hep PV, but I'll save it for another time. When you really do look at all the vaccines, the story is similar. And the main thing is we have no tracking system. And the pharmaceutical industry was granted immunity in '86. Another video for another day. What else do I want to pull into this? Oh, just the pregnancy. OMG here, dude. I am telling you, when you look, this is the original cervical, the original Gardasil. Give me just a second. I know this video is going long, but I had never seen this before. I'm telling you, every time I read these things, my mind is blown to a further extent beyond what I ever thought was possible. The overall proportions of pregnancy that resulted in an adverse outcome. Now, the interesting thing is, it appears they did not screen for pregnancy before they gave women the Gardasil shot. They did in the Gardasil 9 study. They really screened, and they said, you better wait till after your pregnancy's over. But anyway, and when you read this, you'll understand why. The overall proportions of pregnancies that reversed in an adverse outcome. Now, it's funny, they don't say serious adverse, they say adverse outcome. Defined as the combined numbers of spontaneous abortion. I'd say that's adverse. Late fetal death. Yeah, I'd say that's real adverse. A congenital anomaly. Cases out of total of pregnancy outcomes for which an outcome was known, and excluding elective terminations, with 22.6% in women who received Gardasil and 23.1% who received AHS or saline placebo. Again, combined, this guy didn't go, okay, well, what percent of the pregnant women got that had an issue, an adverse reaction, if you will, versus the 3,000 or plus that got this. Do you see what I'm saying? Then I'll break that down. No. But suffice it to say, a little less than a quarter of the women who were pregnant, something went bad wrong. It was only considered adverse, though. It gets better. Overall, 55 and 65 women in the group that received Gardasil or AHS saline placebo, respectively, 2.9 and 3.4% of women, which I think comes to 6.3%. Yep. Experienced a serious adverse reaction during pregnancy. The most common events reported were conditions that can result in cesarean section. Anyway, they give a list there. I won't go into that. But my point is, again, 6.3% of the pregnant women had a serious adverse event that had, again, what chance there of maybe getting the cervical cancer or any of the other types of cancer? Pretty low. Additionally, there were 45 cases of congenital anomaly in pregnancies that occurred in women who received Gardasil, and 34 cases of congenital anomaly in pregnancies of women that received the AHS or the saline. And they don't break it down to who, because, why would we break it down? Yeah. It's easier to, and see, most people don't even realize, because they call this bunch the placebo group. So if they look at it and they go, oh, well, you know what? It just, that's just luck of a draw. But here again, both times we're injecting the same adjuvant. We're injecting aluminum, which in the Gardasil was 225 micrograms, along with some polysorbate 80 and a few other goodies. And then in the new Gardasil 9, we're up to 500 micrograms, because we got to have that adjuvant to mount so the immune system will mount an immune response. I don't know how much you know about all that. I didn't know anything. I didn't get trained in any of this in pharmacy school, but I have learned it, and it's pretty darn interesting. So, that's where I'm at on HPV. You draw your own conclusion. I really do appreciate you continuing the discussion. And I'm trying to think. Oh, I'll tell you another thing. So we're injecting 9 to 12-year-old women. No long-term studies to see if this affects fertility in any way. And yet, interestingly enough, here we are in 2019, which is 13 years post, and we're at the highest rate of infertility globally, actually, in developed countries, which are all giving it HPV incidentally. Now, is it because of the HPV vaccine? We don't know. It seems like maybe there should be some follow-up studies to see, because I know that I have personally talked to people who received HPV who either have had miscarriages out the wazoo, they can't get pregnant. I mean, it's not a pretty picture. But we didn't do any of those studies. No, we had to rush a vaccine to the market because there were women in danger, baby. Women in danger. I'm sorry. I really try to leave the snarkiness at the door, but it drives me insane. And now, how many lives are potentially ruined because this vaccine proved in clinical trials to be dangerous? All right, I'm trying to think if there's anything else I want to say in this. I think I'm just going to add this one thing. You know, if we're looking at a generation of well children right now, I could go with the vaccine program. I would probably still say it's not for me, not for my kids. We don't want to go there, but I could maybe advocate for it a little bit. I just can't. I can't. Our kids are sicker than ever. They're estimated to not outlive their parents in this generation. It is heartbreaking at the very least. It's heartbreaking. But anyway, I appreciate you continuing to listen. I appreciate you continuing to go back and forth with me. And I will continue to feed you information from outside sources. All right. You might think about getting on Facebook. Just saying. I know you're probably not a big social media person, and I get that. There's a lot of stigma with social media. I didn't used to be either until I realized that was the only place I was going to get real news. So there you have it. All right. Well, take care, and we'll talk soon.